Breastfeeding can be a beautiful and rewarding experience, but for many mothers, it also comes with challenges, especially in the early days. Struggles with latching, milk supply, soreness, or simply the stress of a new routine can make breastfeeding difficult. Remember, you're not alone, and these challenges are more common than you may think. With patience, support, and some helpful strategies, you can work through these obstacles. Here are some suggestions to make breastfeeding more manageable. Seek support early. Don't hesitate to reach out to a lactation consultant, breastfeeding support group, or a healthcare provider. They can provide personalized advice and support tailored to your needs. Find a comfortable position. Experiment with different breastfeeding positions to find what's most comfortable for you and your baby. Using a nursing pillow can help support your arms and back, making feeding sessions easier. Take care of your body. Staying hydrated, eating nutritious meals, and resting as much as possible will help support your milk supply and energy. Remember that self-care is a vital part of caring for your baby. Address pain and discomfort. Soreness and discomfort can be managed with techniques like proper latching, nipple creams, or cold compresses. Don't ignore persistent pain. It may indicate an issue that can be corrected with guidance. Practice patience and flexibility. Breastfeeding is a learning process for both you and your baby, and it may take time to find your rhythm. Be kind to yourself as you learn and adapt along the way. While every mother's breastfeeding journey is unique, with support and some patience, you can navigate these early challenges and find what works best for you and your little one.
For new moms facing difficulty with breastfeeding, breastfeeding can be a rewarding yet challenging journey, especially in the beginning. Here are some helpful tips to make the experience smoother. Get support early. Reach out to a lactation consultant for guidance on latching, milk supply, and comfortable positions. Find a comfortable position. Experiment with different positions like the cradle hold or sideline to find what works best. Stay hydrated and nourished. Drinking water and eating balanced meals can support your milk production. Use a nursing pillow. This can help reduce strain on your arms and back. Take care of your nipples. Use lanolin or nipple creams to relieve soreness. Take deep breaths. Relaxation helps with milk flow, so practice deep breathing during feeds. Try skin-to-skin contact. Holding your baby skin-to-skin can stimulate milk production. Let go of perfection. Remember, it's okay to have bumps along the way. Feed on demand. Feed your baby when they show hunger cues rather than following a strict schedule. Rest when you can. Sleep is essential for your recovery and can support milk production.
Tips for mothers with low milk supply. If you're concerned about low milk supply, there are ways to help increase it. Here are some tips to boost production. Feed often and on demand. Frequent feeding helps stimulate your body to produce more milk. Use both sides. Try to offer both breasts at each feeding to stimulate milk production on both sides. Power pumping. Try power pumping 10 minutes on, 10 minutes off for an hour to mimic cluster feeding and increase supply. Stay hydrated. Drink plenty of water to stay well hydrated, as dehydration can reduce milk supply. Add galactic oat foods. Foods like oats, fenugreek, and fennel are believed to support milk production. Limit pacifier use. More time on the breast will help stimulate milk production. Check for tongue tie. Sometimes low milk transfer is due to the baby's latch. Ask a specialist to check for tongue or lip ties. Massage while feeding. Gentle massage while nursing or pumping can encourage letdown and flow. Avoid supplementing too early. Supplementing can sometimes reduce demand, affecting your supply. Prioritize self-care. Stress and fatigue can reduce milk supply, so rest and take care of yourself whenever possible. Tips for mothers who want to stop nighttime breastfeeding. If you're looking to reduce or stop nighttime breastfeeding, here are some gentle ways to make the transition easier. Introduce a dream feed. Try feeding your baby just before you go to sleep to help them sleep longer. Slowly space out night feeds. Gradually extend the time between feedings so your baby becomes used to fewer nighttime feeds. Offer comfort in other ways. Use rocking, singing, or gentle patting to comfort your baby without feeding. Reduce stimulation during night wakes. Keep the room dim, quiet, and calm so your baby learns that nighttime is for sleeping, not feeding. Give a pacifier. If your baby is comforted by sucking, a pacifier can sometimes help soothe them back to sleep. Consider a partner's help. Have your partner take over nighttime soothing if your baby associates you with feeding. Make a bedtime routine. Establishing a relaxing routine before sleep can help your baby feel calm and secure. Try Dream. Feeding less over time. Gradually reduce the amount or duration of Dream feeds. Offer more during the day. Ensure your baby is well fed and satisfied during the day to reduce hunger at night. Stay consistent. Transitioning can take time, but staying consistent with your plan will help your baby adjust.